which is what you feel right here. And so on one side, you had a tear with a gap from here all the way down. So that's why on that picture you saw that spacing, where you saw a big wad of tissue on one side and a little gap on the other side. So this was chronically torn. Does that make sense?
Mm-hmm.
So you had a chronic tear there. So when you contracted your quad muscle, that area that was torn was pulling. So that's why you were having the pain. So in surgery, what I did was the tendon that was not healthy looking, I cleaned all of that out. So I cleaned it out to new or fresh looking tendon. And so that's why on the picture, the photograph during surgery, you see a big gap.
Mm-hmm. Mm-hmm.
Underneath that gap is the actual kneecap or patella. So what I did is I drilled a hole in there, and you put this absorbable anchor. So think of it like when you're putting sheetrock up, and if you're not on a stud, you put that thing in there and it has little spikes and it spikes out.
Mm-hmm.
You know what I'm talking about?
Mm-hmm. Not really.
You do, you hang pictures at home?
Right.
So you know how some you drill a little hole and you screw the thing in there, and then the inside of it has threads?
Mm-hmm. Mm-hmm.
So that way you can hang the screw through and the
Right.
picture can hang. Well, it's the same thing.
Okay.
So
Okay.
you drill a hole and then you screw a device and it has little barbs on it, and inside of the barbs come out suture. Okay? That material is not a metal, it's sort of like an organic plastic. It's not a plastic, but it's an organic material that'll dissolve over 4 to 6 months.
Okay.
Once it starts dissolving, the bone is going to grow over it, and so then at 6 months it's going to just be a solid piece. You're not going to see the hole anymore. So the sutures will now be covered in bone. So the sutures are coming out through the skin like this. So you have suture ends coming out like that. And so then what you're doing is basically like repairing a tear in your pants. So you got this rent here, you got sutures coming out, you put a needle on the end of it, you go one way, you go the other way, you repair everything back together, you tie everything up, and then you suture it down.
Mm-hmm.
Then once that's done, there is like a collagen which has factors in it to help the tissue to heal. I put that patch on top of it, so that's what that little white patch was that was on the top of that.
And the picture?
Nope, you didn't get that. On your picture you have, it's completely closed, and then you see, you're not going to see it, but it's sort of like a cellophane that's sitting on top of it.
Okay.
So the cellophane portion, what that is it is placental tissue, amniotic tissue. And so what it is, it's not cells, it's the factors from amniotic tissue that has growth factors, healing factors, and that sort of stuff. It doesn't have live cells in it, but it has the factors in it. So it helps the tissue to heal.
Okay.
So that sits on top of the tendon and it's underneath the tendon. And then I close the skin up over the top of
Okay.
it. Okay?
Okay.
All right. So
and that
when
dissolves too, you said?
well, it's almost like those mint wraps, you know, like the mints you take that come out like in little sheets that you just put on your tongue and they dissolve. It's the same kind of thing. It's the material is on this kind of, it's not a cellophane, but it's on this kind of sheet type material that as soon as it gets wet, it starts dissolving. That's why once you set it down, you have to set it down with tweezers, because if you try to start touching it, it starts coming apart immediately.
Okay.
Because it's as thin as, like I said, it's like thin, that breath mint paper that you can put on.
Okay.
All right?
Okay.
All right. So I'm gonna take this dressing down, and what you're gonna see underneath is the dressing. You can pull your hand up. So what you're gonna see is the actual dressing, and instead of it being gauze, it's a newer device, which is basically a 7-day dressing. So it looks like a big Band-Aid with tubing on it. And so what that does is it applies suction on the skin. I'm gonna lift your leg up. Suction on the skin such that it keeps it dry. It also prevents the skin, allows the skin to start healing.
You talking about this right here, the purple?
The purple thing.
Okay.
So I'm gonna cut this off for you now. I'll give you a new one.
feels so good just to have.
And then you can shower. You get on some gloves. You can see the little device out of your pant. So you get this. This is the little pump. It has a little chip in it.
You was tracking me, Doc?
Hmm?
You was tracking me, man?
No, man, that's your wife. I don't do that. Joke.
You do that well.
All right, so that goes in the trash can. So that helps to keep suction down. And so then I'll just pull this back. Let's get a corner that'll roll back.
I can't believe she was like, you kept it on the whole time. I was like, I was supposed to. I thought
What?
the whole everything. I kept
Yeah, you
everything
keep
on.
everything on. You don't
Yeah.
have to take it off.
She was telling me, I guess, how patients don't.
They don't listen, some patients, and they take stuff off.
She was surprised that I actually did. I was like,
No, you're good.
yeah, I want to heal, man. I want to heal right.
Yeah, that's
Let me know
good.
when the needle was out.
There's no needle. It's
You sure?
like, of course, it's like a big Band-Aid. It's nothing.
She told me it was a needle, and on the video,
No, it's no needle. It's no needle. It's no needle.
it's not a needle on my knee.
No, it's no
Alright,
needle
cool.
in your knee.
Cool.
No, it's just like a big Band-Aid.
Yeah.
So think of it like a big Band-Aid.
Can't believe it's not hurting. Man, why she tell me it was a needle in the video?
No, there's no needle.
Thank
no.
you, God.
No needle. So all of the sutures are underneath the skin. So there's no sutures to take out. So what I'm going to do is spray a sticky stuff on it, like Sickum, like from football back in the day, and then put some little strips on it, little butterfly strips, and that's it. Put another A-strap on it. You can keep the A-strap on it if you want, or you can take the A-strap off if you don't want it.
But I'm gonna keep the mobilizer, right?
Yeah, keep the
Yeah.